Hey, it's Dr. Jeff Pierce from Michigan Sports and Spine. We're almost ready to stop counting our shows. We're at number 26. I think once we hit 30, I think we're going to be here to stay. But, I just have to show off for a second. Big weekend. I didn't talk about it last week because I was a little concerned about the Michigan State game. But I am sporting my Spartan shirt. So for all of you that are wondering why I'm wearing this casual outfit, that's why. So go Sparties. I don't know about those U of M guys. I'm sorry. I don't know what to say, but that's another great year of bragging rights on our part. So Nicole doesn't want me to get off on this. I figured it was better to talk about the Michigan State game than about if we're going to have a president by the end of the month. So we're going to keep it real. We're excited today because if anybody was familiar with my radio show, we always had guests on. And we've been struggling to have guests. We've talked about my virtual team. And one of my key players for our virtual team is Erin Johnson, who's going to be on with us this week or today. So we're going to do a few things. She's working on somebody, and she can't get on at 3:30. So we'll get her on in about 10 minutes or so she can finish up with one of her clients. But the bottom line is it's the whole team event. I keep talking about the virtual team, and it's real. We really have it. It's a new normal. We have access to people that are phenomenal. We have access to a trainer in California, some of my doctor friends in New York and Utah, and we're able to kind of grasp from everybody, including some of my athletes, which if we can work this out, we'll start getting some of my athletes, some of my Red Wing friends to come on and stuff like that, get this more interactive and get going. You can actually see my Lindstrom picture behind me, so it's fun and exciting. And we want to get back to it. We want to get back to this new norm where I'm dealing with the rock stars and everyone else. So getting into question one before we get Erin on, we've had a lot of questions. We've actually had so many questions, and we apologize up front that we're not going to get to all of them today. But, I really appreciate it. The interaction has been great. So the first question is, hi, so I have a terrible spine, and especially bad C6-7. But desperately need a surgeon. Is there something your surgical team can help me with my neck? I need to find a good surgeon to improve, to do this, sorry. So yes, Michigan Sports and Spine, we're all non-surgical, but we have a whole team of surgeons we work with in the city. We don't just work with, Beaumont doctors, Oakwood doctors, the Providence. We have a team of doctors that we try to fit kind of personalities to and what's going on physically and findings wise. So we will, for this person here, number one, are you one of my patients, number one? Two, for everyone else out there, if you are having like I had a patient today, terrible neck issues, just miserable, can't sleep, called his bed a roller coaster because all the pillows and everything were all over the place when he wakes up. He doesn't know exactly what he does, but he can't sleep for more than 2 hours. Those are people we get right in when we start doing injections, because sometimes nothing else is going to cut down the pain until we do the injections and bring it down to an achievable level for the therapist to deal with. Again, I've mentioned it multiple times that if we can't control your pain, your therapist is going to spend a lot of time, trying to control your pain, never getting to phase 2 in my 4-phase system. So we have to control the pain right away. So what we're doing is, especially with this, you say you need surgery. This other person thought they needed surgery. They actually saw a surgeon, and there's someone that's like, we need to explore all the other options. Now, if you have emergency signs, then that's a different story, and then we'll get you to the surgeon right away. And again, we have a great team of surgeons in this city. Probably I feel I work with some of the best surgeons in the city. I just had a rep in here who started talking about, there's a lot of spine surgeons out there, and he started mentioning things that they do, and I'm happily saying we don't deal with any of those type of people. We don't deal with a surgeon who's not comfortable saying you don't need surgery. You have to go to someone that's very skillful, that they're busy enough that they don't have to just do, I want to say unnecessary surgery, but things that are kind of in the gray area may go a little bit more surgical when they can be played out from a non-surgical standpoint. So yes, the simple answer is yes, we do. You need to be seen by someone like us. If you've been seen by us, then we definitely would have you in our system, and we can get you to someone that can help you. So question 2. I love that you use a non-surgical approach. Can you rank these alternative treatments practices in order of how beneficial you think they are or are not? So it says massage therapy, acupuncture, IV therapy, aromatherapy, essential oils, yoga, and meditation. So this is a loaded question that I'm not going to answer because there is certain situations. It's not like boom, 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 boom. You know, for the office, it's simple. We talk about home exercises, we talk about therapy, we talk about medication. That doesn't work, we talk about injections, and then we talk about surgery. Every one of these things we can add in at any point. If you're in severe pain, you're not responding to what I say of manual therapy with the therapist, massage therapy, whoever hated a massage therapist, they're always beneficial. It gets down to cost sometimes and time. But a good manual massage therapist that's going to spend 60 to 90 minutes with you is definitely beneficial for the soft tissue. And if you're doing certain massages where it's more of a Swedish massage or a Thai massage, there's certain techniques that are definitely beneficial to your spine and your soft tissues, like in your legs. If you're having a back pain, you're getting that terrible pain down your leg, your muscles will spasm. As a protective thing, you have to release all that stuff, and massage is definitely a way to go with that. So that's absolutely important. Acupuncture is a different science behind it. With acupuncture, it's the meridians, okay? That's actually like trigger points. You're trying to take the circuit. So when I talk about it, it's like a circuit that's overflowing, that's overfiring. Sometimes the acupuncture is there to reset. It hits the reset button, like on your phone. You gotta hit sometimes the reset button. Shut it off for a minute and turn it back on. It's kind of the way you can easily think of acupuncture. I'm gonna get called by my acupuncturist and say, "Look, Jeff, it's not that simple, but we'll deal with that then." IV therapy is an adjunct to treatment. It's more of like the healthy. There's things for brain power, for muscle power, for recovery power. All those things are helpful. I've always said the body is the best mechanism, the best tool for it's the best mechanism to heal. Allow it to self-heal. I think we put out a quote a couple of weeks ago that your body is the best thing for self-healing. It's the most organic way to heal, and the better you treat your body, the better you have for recovery chances. So IV therapy is better for that. It's not for like, oh my God, I have terrible radicular pain. IV therapy is going to help. It's not for that. But if you're getting run down, you're not being able to do things because you're in so much pain. Like I've been in discomfort now for 2 weeks, and I'm a little bit more fatigued. My legs wearing out a little bit quicker. It just kind of boosts you up. Like the last patient I talked to before this, she's like, when I'm on steroids, I always feel better. So it's not that it's more of a natural steroid when you get the right ingredients of IV therapy. So there's a role for all of them. Aromatherapy, essential oils, it does do something to your sensation and your senses to kind of turn off, a lavender, which I always go to the lavender because that's the only one I know the best. But those are definitely play a role. Again, not going to solve it. It's just one of the multiple tools. Yoga, meditation, huge for flexibility, self-control, able to get yourself feeling better overall. I got so many cameras here, I don't even know which one to look at. So right now we're on Facebook, we're on Instagram, and we're on YouTube Live. So we've expanded our audience. I mean, we're just, we're like on the big 3 channels here. So it's really cool, but we're going to get Erin in here after one more question. And this is her leading question. When do you recommend a trainer versus a physical therapist? So the trainer, Erin is a unique person. That's why I've picked her to kind of come on, and why we've worked so well together, because we're both kind of unique in our field. We kind of know our field very well, which she's a natural trainer, but she's also has skills in massage therapy and also physical therapy. But some of my great physical therapists, they want to be able to complement each other. So it's a complementary thing. So typically when you're in that bad acute pain, what we call the phase 1, in the beginning of the phase 4 problem, you're really starting off with a physical therapist. A good manual physical therapy is going to get you there. When I get you from phase 2 to phase 3, now we're starting to talk about more active. We're starting to talk about flexibility, core strengthening, and conditioning. That's where the trainer, and well-educated trainer, is going to help. And every trainer, as much as I say every therapist isn't equal, every trainer is not equal. Some of these trainers are, I'll get yelled at, but borderline scary what they do with patients. I mean, it's, you know, it's you just have to go to a skilled therapist, or trainer, and that's why Erin is so good at that, because she understands the body mechanics. So I think that's the best intro I can do for her as she approaches into our program. Hey there.
Hi.
How are you?
I'm well. How are you? Do I have to adjust this?
Yeah, so
I've never done this.
So what we're doing, yeah. So what we're doing is we're switching from Facebook to Instagram for all the people following us on Facebook. So you can see Erin, or you can at least hear her. But if you can switch to Instagram right now, this is like transitional. So we'll see how well we're successful at